of warming up.
No, we
Got a sweater and a flannel shirt, and I'm still kind of chilly. Okay, this is the second in our series of talking about abortion, and certainly we're really, really happy to have one of our own here to talk to us about this really important topic. Sherry has asked before I introduce her that if you have questions, put them in the chat, and she will be monitoring the chat, and she'll try to answer them as we go along. So you don't need to hold them to the end or anything like that. So I'd like to introduce Sherry for people who don't know her. Sherry received her MD degree cum laude from Thomas Jefferson University and did her residency in obstetrics and gynecology at the Medical College of Philadelphia. She was a practicing physician at Women Care OBGYN in Willow Grove from 1990 to 2014, where she was partner and vice president, and she is certified by the American Board of Obstetrics and Gynecology. She's a fellow and past chair, vice president, and treasurer of the American Congress College of Obstetricians and Gynecologists, and presently serves on its advisory councils for District 3 and Pennsylvania. She's a founder of the PA Medical Society's Women Physicians Section and Women's Physician Caucus, and serves on the Board of Trustees for Obstetrics. She has served on the Executive Council for the Philadelphia Obstetric Society and is a member of the North American Menopause Society, the American Medical Association, and the Montgomery County Medical Society. She is well published and sought after as a speaker, and we are so proud to have her as a member speaking to us today on abortion from a medical perspective.
Okay, thanks. So Liz is going to put up the PowerPoint.
Are you ready for that to go up now?
Yep, we're ready. And, you know, I
Okay.
want to thank everybody. I assume people can hear me. I want to thank everybody. And it's really a pleasure to be a part of this organization of incredibly smart, committed women. And, you know, hopefully this will be somewhat edifying. What I'm going to do is talk about fact. And I'm going to talk about fact as we know it. And it may be elementary for some of you, but I don't know how much of the total medical details you know. And my feeling is if we're going to advocate for keeping abortion legal, which in my humble opinion is absolutely essential to keeping women alive, we need to know facts, because there are huge numbers of people there that are rabidly opposed to abortion being legal and will say anything because they feel they are saving lives, and they don't consider that there are women's lives also that maybe they should be thinking about. So at any rate, this is just my cover slide, and it's just a pretty picture with nice colors. So I think you're gonna advance for me, Liz, please. Next slide. Okay, so the first thing I want to do is just go over the anatomy of the female reproductive tract, because that's important. Can you guys see it?
Yes.
Good.
Yes.
Okay, so it's a little blurry because, you know, my forte is not making PowerPoints, but at any rate, this is our reproductive organs, and this is the uterus here, and the endometrium is the lining inside the uterus. If I may mention it. And it's very important, of course, in the establishment of pregnancy. And then these are the fallopian tubes and the ovaries. And the cervix is the entrance into the uterus, and this is the vagina. So basically the sperm comes up here into the uterus, migrates into the fallopian tube, and I'll show you more pictures. And the egg comes from the ovary. Next, please. Okay, so first of all, how many weeks pregnant is a woman? This comes up in all the laws that are being passed now. We date the pregnancy from the last menstrual period. Now that is a bit concerning. By the way, I assume you cannot see my arrow?
No.
Okay.
I can use mine. I can use mine if you want to, because it's my screen.
Bullet. Yeah, ovulation occurs 2 weeks after the last menstrual period if a woman has a 28-day cycle. So in fact, For the first 2 weeks after a woman's last period, she is not pregnant, but this counts towards the weeks of pregnancy. It's a convention. Fertilization occurs within 24 hours of ovulation, and it occurs in the fallopian tube. So 2 weeks after the last period, assuming a woman has a regular 28-day cycle, and of course, women are all different, but that's the average. So 2 weeks later, a woman ovulates. If there happens to be a sperm that makes it through the cervix and up into the uterus and fallopian tube, that egg may be fertilized. However, the fertilized egg, which is now one cell, remember, the sperm has half the number of chromosomes, the egg has half the number of chromosomes of a human. And when they combine, they form a fertilized egg or zygote, which is one full cell with the total complement of chromosomes, which in humans is 46. So from the fallopian tube, and I'll show you a picture, it then travels and eventually implants in the endometrium or lining of uterus 6 days after fertilization. Now, we consider in medicine that pregnancy begins at the implantation of the multi-celled stage, which is called the blastocyst, which I'll show you a picture, in the endometrium, in the uterine lining, because that is when it starts, the implanted developing embryo starts to produce a hormone called beta HCG, which then can be picked up in the bloodstream. So the due date, which we call the estimated date of confinement, or EDC, that's a very old-fashioned term, is 40 weeks from the last menstrual period. Actually, if a woman makes it to her due date, the fetus is 38 weeks old. So I know it's confusing. I'll go over it again. Next slide, please. Okay, so here we go. Ovulation, fertilization. Can you see where it's over? Yeah. And follow along up to the left is the zygote, which is the 1 cell phase. Then 48 hours later, it's the 2 cell stage. Then it's the cells split to 4 cells. Then those cells split to 8 cells, become something called a morula in 72 hours, and then form a structure called a blastocyst. And that is the structure that implants in the uterine lining about 6 days after ovulation. So in our medical opinion, pregnancy begins when the blastocyst implants. An awful lot of times it doesn't, it just passes through and the woman never knows she's pregnant. But if it doesn't pass through and implants, that will establish a pregnancy. Okay, so I haven't checked the chat yet, so I'll check it in a little bit. Let me go through a few of these. Okay, is it too soon to switch slides, or would you like me to?
No, go.
Okay, so the fetus is actually 2 weeks younger or less developed than the age of the fetus dated from the last menstrual period. Now, a heartbeat, something flickering, I should say, because now that's very, very controversial. If it's actually a heart or just a flickering tube with some electrical signals, you can see something flickering when you do an intravaginal ultrasound, a pelvic ultrasound with it's the beginning of the last menstrual period, Margaret, that we date from, the first day of the last menstrual period. So 6 weeks means approximately 4 weeks from the beginning of the last menstrual period. So you've got an embryo and you've got something flickering that you can see on a vaginal probe ultrasound. If you listen with ultrasound technology, at about 10 to 12 weeks from last menstrual period, you can actually hear something that sounds like a heartbeat. But the pregnancy can be detected by a blood test, which we call a beta HCG, about 4 weeks from the last menstrual period, which is right before the missed menstrual period. So quite honestly, a woman is already 4 weeks pregnant from LMP by the time she thinks she may have missed her period. And that's in women who have a 28-day cycle regularly. So, we're talking here, a drugstore pregnancy My bet is that that is probably a home pregnancy test, which probably will not be positive until 6 weeks past last menstrual period. That's the one that's done on the urine. And you know, that's older. It used to be even later, but this is the blood test is much more sensitive, meaning it'll pick up a pregnancy earlier. But nothing can be picked up until that blastocyst implants in the uterine lining or endometrium. Okay, next slide, please. Okay, this is just to give you an idea of trimesters. I'm sorry it's blurry, but the first trimester, and I'll go over the weeks with you as well. The embryo is basically developing. It basically starts to develop arms and legs at about 7 to 8 weeks from last menstrual period. And goes up to about 14 weeks from last menstrual period. Second trimester is 14 to 28. Now, in the past, 28 weeks was the time of viability, with a tremendous amount of support and intensive care in modern times. However, that has been pushed back in rare cases to 23 to 24 weeks, and I'm happy to answer questions about that as well. And then this, of course, is third trimester, when basically you have all the development done, and now we have growth and more what we call differentiation. The cells take on more of a specialized function, and the fetus gains weight and usually settles down head first, we hope, in the pelvis. Next, please. Oh, but back one.
Oh, I'm sorry. Did it skip? Okay.
Yeah.
there. Sorry.
Okay, so this gives you an idea of the trimesters. So your first trimester is about up to here. So, you know, it just gives you kind of a feeling for the relative development. And then the second trimester up to 28 weeks, and then the third after 28 weeks. And viability, what viability means is this fetus has a prayer of surviving outside of the uterus. Now, do 24-week fetuses often survive, and do they turn out normal? Well, approximately 10% with incredible intensive care and being delivered in an academic high-level hospital, approximately 10% survive. Of those, only about 10% have no disabilities. So we are talking major issues at that gestational age. The limiting factor is the lung development. Up until approximately 24 weeks, the lungs are not yet able to exchange oxygen. For those of you who know something about the structure of the lungs, you have the trachea that brings air down to the lungs. It divides into 2 bronchi, one that goes to each lungs, carrying air. And then within the lungs themselves, the bronchi divide into smaller and smaller ones until they end in these little tiny grape-like sacs called alveoli. It's A-L-V-E-O-L-I. The alveoli have very, very thin walls. And it is across the alveoli that oxygen that is breathed in gets exchanged into the bloodstream. The blood vessels come right up against the alveoli, and the oxygen goes from the alveoli, which are little tiny air sacs, into the bloodstream where it's needed. The idea is, if the alveoli are not developed, there is zero way to get oxygen into that baby unless it's put on something like a heart-lung machine. And there is a technique which has been used in COVID as well called ECMO, ECMO, where they actually take the blood out of the body, put it through a machine that oxygenates it and puts it back. There are huge potential complications with that in terms of abnormal blood clots, which is like a stroke in a 23-week-old fetus. So, and most places don't have access to it. So, we're really dealing with this fetus is completely and totally dependent on the woman who carries it up to 23 to 24 weeks. And then it is only with intensive medical intervention, which it may survive, and may come out relatively normal once a fetus gets to about 28 weeks, at the end of the second trimester. If it's in a good intensive care unit, most likely it will survive. But what they call viability, which is again what Roe v. Wade covers, which I'll go over, was 24 weeks. Okay, next slide, please. Okay, this is kind of a beautiful picture, actually. And this is at about 7 to 8 weeks from last menstrual period. And this is the fetus, and you can see that it's just kind of developing limbs and, you know, has a very, very large head, a not well differentiated face. This is the umbilical cord, which is coming in here. And the umbilical cord comes from the placenta. And there are layers. There are 2 layers here. The chorion is the outer layer that lines the sac that the fetus is in. The fetus is something called the amniotic sac. There are 2 layers. The chorion is the outer layer, the amnion is the inner layer. And these layers produce amniotic fluid that the fetus floats in. Now that red meaty thing to the right is the placenta. The placenta is also formed by the embryo and attaches to the inside of the mother's uterus. Now, the way the baby, the fetus, gets oxygen is the mother's blood vessels go into the placenta. They come right up against the fetal blood vessels that come in through the umbilical cord. And those vessels, which are tiny little capillaries at that point and have thin walls, across the wall of the vessel from mother to fetus goes oxygen and nutrition, mostly sugar, glucose, and waste materials from the fetus go across into the mother's bloodstream, and the mother, the pregnant woman, eliminates it. So this is a relationship where this fetus is completely dependent for oxygen and sustenance from the pregnant woman, and that is basically the fetus is a parasite. Next slide, please. Okay, now this is what a second trimester fetus looks like. You can see it's starting to look a little bit more human, but it's still way out of proportion. Okay, next, please. Okay, so terminating a pregnancy, which is what this talk is about. First of all, medical terminations are relatively new over the last 10 years or so. They require the administration of 2 drugs. The first one is called mifepristone, and that is, it opposes progesterone. There are 2 major hormones that women produce that are unique to women, and both of them are in very high levels during pregnancy. One is estrogen, the other is progesterone. Progesterone's name is from progestation. In other words, it supports gestation or pregnancy. That's where the word comes from. And progesterone levels get very high during pregnancy, and that helps keep the uterus relaxed, because there's a problem here. This uterus is expanding and growing. And when you try to stretch a muscle, its tendency is to collapse. You know, like when your bladder gets full, that's a muscle, and you feel the urge to go, and then you empty it and you feel better. So you stretch the bladder, the bladder signals you time to empty. Well, same thing with the uterus. So something's got to keep this uterus from forcing this fetus out at 4 weeks, because it's starting to enlarge. The cells in the uterus enlarge and the uterine wall stretches. You don't get more cells, you get bigger cells and stretching. So the progesterone relaxes the uterus. And in fact, it's the high levels of progesterone that give so many pregnant women constipation, because it also relaxes your intestine. So what mifepristone, or it used to be called RU486 when it was in development, what that does is it antagonizes the binding of progesterone to the uterus. So it works against the progesterone, which maintains the uterus holding on to the pregnancy and prevents it from binding in places inside the uterus. I'm not going to go into all the science there. The second drug that's given, usually 24 to 48 hours later is misoprostol, which is something that causes contractions. It is what's called a prostaglandin, and we know there are a million drugs out there that people use for reflux that are antiprostaglandins. We use antiprostaglandins to relieve a lot of joint pain because prostaglandins are involved in inflammation. What misoprostol does when you take a pill, and again, these are just oral, it causes the uterus to contract. So basically what happens is the fetus, in a sense, loosens up. It kind of loses its grip. The uterus no longer supports the pregnancy, and then the misoprostol causes contractions, and then the uterus itself expels the embryo/fetus. Now, misoprostol only works in the early stages of pregnancy. Every once in a while, it may work up to 12 weeks, but the probability of it being successful, which is very high at 8 weeks, becomes lower and lower as you get to 12 weeks. So right now, almost 50% of terminations in the United States are performed medically. Second bit that's very important to understand, 90% of abortions in the United States are in the first trimester. 90%, which is most of them. Okay, now the surgical procedure, which is actually very simple and very, very safe when performed by someone who's well trained, is called a D&E, or dilatation and evacuation. Basically what happens is the cervix, which I showed you in that picture, is closed during pregnancy. Nothing can get through, and it has a big plug, of mucus, which prevents sperm from coming through, but also prevents the fetus from leaving. So it's kind of sealed with this mucousy junk, and it's closed. So the first thing you have to do to get into the uterus is you have to use these tubes, which I took all the pictures out of this, which you just put through the cervix and gradually stretch the cervix, which hurts, which is why most of the time sedation's used. I mean, obviously when an abortion is illegal, or when it's done in a place where there's no money, or in poor people, they often have no anesthesia at all. So this really, really is very painful. So you dilate, that's the dilatation. Then you insert something in the uterus, usually some sort of suction device, and you just apply a vacuum or suction, and everything sucks out very, very easily. It's extremely small. At 8 weeks, you need a suction device that is 8 millimeters in diameter, which is a little over 1/4 of an inch. It's pretty small because everything is really little and it's all very soft, and it all just comes right through the tube. Then you put an instrument in, a curettage, which is the C of D&C, and you make sure the walls are clean, that everything's out. And that's the procedure. And the procedure can be done probably within 5 to 10 minutes. And afterwards, there's a little cramping, it goes away. There's a little bit of light bleeding, that goes away. The chances of risk, which are basically either perforation or infection, making a hole in the wall of the uterus is perforation. The risk is extremely, extremely low. Okay, now I just see, before I go to the next one, I see a question from Eleanor. Yeah, everything that I'm talking about now is based on last menstrual period, Barbara. So miscarriage, there's a lot of reasons for miscarriage. The most common reason is there is something abnormal with the formation of the fetus, and it doesn't develop. And therefore, nature's way of, I'm speaking teleologically, which I shouldn't, because they don't develop, therefore they don't survive, and they just get past, and that's it. And in fact, we used to think the miscarriage rate was about 25%. We realize now that it's over 50%, but so many women don't even know they're miscarrying because the fetus will be abnormal. They won't know it. Their period will be a week late and they'll pass it, and they just think they're having a bad period. But it is mostly genetic, either chromosome abnormalities like Down syndrome, abnormalities that have formed that are incompatible with survival. So that's most miscarriages. A few are blamed on a lack of progesterone, but tests can be done for that. And there's some women that are supplemented with progesterone towards early pregnancy. This is very controversial as to how it's done and how much. So I really don't want to get into that, but sometimes it helps. But in a lot of cases, if a woman has multiple miscarriages, the first thing we do is we look at the expelled fetus for chromosome and genetic abnormalities. And that way we can tell, is this just a sporadic thing that just happened this time? Or could it happen in multiple pregnancies? And I've seen quite a few patients who, when you put the parents together, the fetus had a chance of having very specific chromosome abnormality. And it was just a matter of chance if they were able to have a live baby or not. And, if they kept trying, sometimes they did. But of course, miscarriages, horribly disturbing to a couple. I mean, it's a big loss. Okay, next slide, please. Okay, so this is kind of what the vacuum tube looks like. Again, poor picture, but what are you going to do? So you can see all the way on the right, that's the thickness of a tube. And this is these can be done in the office. Sometimes, yeah, menstrual extraction is really a very, very old term, Margaret. I think in a way, menstrual extraction was really a very early abortion. I think it was a euphemism for it, but this is how it would be done. And if it's a very, very early pregnancy, you may not even need to dilate or open the cervix. So as far as I know, I've never heard of anybody that I know performing anything called menstrual extraction. All right, next, please. Okay, so for the second trimester, if you have maybe 14, 15, 16 weeks, you can still do a D&E, although suction may not work if you get closer to 14 to 16 weeks, because you now do have body parts that will not fit. And this is not a wonderful thing to see or do. I learned this in my residency. Since then, I never did one. It's very upsetting, but it works. And the complication rate for women is slightly higher. And to be very honest, a second trimester termination really should be done in a hospital setting, because there is a higher risk of infection. There's a higher risk of perforation and bleeding. So first trimester are amazingly safe. Once you get into second, even like 14, 15 weeks, it becomes a little bit more complex. Now, when I mention the next one, induction of labor, that is when, and in the past, amniocenteses were usually not done till the late second trimester, maybe 22, 23 weeks, because that was when you could get a needle into the uterus. In the old days, you just stuck a needle in, hoped you hit amniotic fluid, withdrew some, and sent it off, and then it took weeks to get the chromosomes. Now, things have changed markedly. However, in most cases, terminations were performed for abnormal results of amniocentesis, especially, for instance, let's take Tay-Sachs. Tay-Sachs can be diagnosed from amniocentesis, and it's a very simple enzyme assay. So up until the last 15 years or so, all you could do is amniocentesis. Now, all of you know that Tay-Sachs is incompatible with survival. Usually by age 5, you've got a continual decline in function, and then the child dies. It's pretty inevitable. We're now learning that there are adult onset types too, which have some similar symptoms but don't result in death. That's a whole different story. So anyway, over the last 15, 20 years or so, one of our own, Ron Wapner, who used to be at Jefferson, pioneered a technique called chorionic villus sampling. And what he would do, rather than stick a needle in to get amniotic fluid, which did get easier because you could actually look with ultrasound. Now, I don't know how many of you had ultrasound in your pregnancies, but I didn't. They didn't have it. They didn't have fetal monitors. But then, amniocentesis got safer and easier, maybe could be done a little earlier. But chorionic villus sampling can now be done as early as 11 weeks. But you go in through the cervix and you pull out a little piece of the placenta and you submit it and it's analyzed. Now, there are a few problems with this. The risk is a little bit higher because when you do an amniocentesis, there is a risk of infection or a woman going into labor and losing the pregnancy. It's very low. It's less than half of 1%, but it's not zero. With chorionic villus sampling, it's about 1%, but you find out earlier. One of the problems with the results of chorionic villus sampling, or CVS, as it's called, not to be confused with a huge corporation, whose name shall not be mentioned, the results can be confusing because sometimes the chromosomes in the placenta are not identical to the chromosomes in the fetus. But we know that. So the story continues. But at any rate, so if you definitely have an abnormality and it's pretty definitive, and the woman decides she doesn't want to carry the pregnancy, she can still have a first trimester termination, which is a very good option to have. Then, if in the old days you were in your late second trimester and you found out about the abnormality, there were two ways to empty the uterus. One was to inject something in the amniotic fluid that would actually cause labor and cause the woman to deliver the fetus. Or you can also do that intravenously. And there is and I know this sounds gruesome, but you might as well know the truth. In many cases, you can inject potassium chloride right into the heart of the fetus under ultrasound guidance, and that will stop the heart. And then you can induce labor. So, luckily this is rare, but it can be done. Now, we have a new development as well for making diagnoses early, and that is a blood test called non-invasive fetal testing, where blood is drawn from the woman. No chorionic villus sampling yet, no amniocentesis. You withdraw the blood and you extract from it fetal cells, because remember I mentioned that the capillaries, the blood vessels from the placenta and the blood vessels from the mother's uterus get side by side and things go across the walls. Well, oxygen can go across the walls, glucose can, and sometimes fetal cells can. So they look for fetal cells in the mother's bloodstream. And if they find them, they do a genetic analysis on that. And that has zero risk. It's not always right, and you don't always get enough cells, but certainly it's a great development in making these diagnoses, and whether a woman elects to keep a pregnancy or not, as far as I'm concerned, that's her decision. But at least she has information. And that information can be enormously, enormously helpful in, if she decides to continue a pregnancy, how to get help, how to prepare for it psychologically. And if she doesn't feel she can handle it, she can terminate it for now. Okay, so I know that's very confusing and I really didn't have slides on it, but once I started, I figured, and if people have questions, I'll be happy to go over it. Next slide, please. Okay, there is no medical procedure for third trimester abortion. There is no such thing. It is not an abortion. Number two, there is no such thing as a partial birth abortion. Abortion legalization opponents made it up. There are incredibly rare cases. And unfortunately, I experienced one when I was a resident. I wasn't involved in the woman's care, thank God. But this is a woman who had a fetus at the time, and this was a long time ago, that had this huge head because the head was full of fluid. It's called hydrocephalus. Now, they could do an ultrasound of the fetus's brain and realize that there was literally no brain. There were like a rim of cells and that was it. So this was not a fetus that could survive, but its head was too big to come out. So the doctors told the woman that the only way they were going to get this baby out is to do a C-section. Well, the woman refused to have a C-section. So here she is. She's got contractions starting. She's got a head that's twice the size of the vagina. And she refuses to have the baby removed. So there was an option, which ended up not being necessary because they got a court order. I mean, it's terrible she had to have a C-section, but you know, a lot of things in life are not too fair. But what they could have done, which I have never seen anybody do, is deliver the baby to the head and then put something into the head and withdraw the fluid. So they could collapse the head and deliver the baby vaginally. Now that wasn't necessary, but that may be what they think is a quote partial birth abortion. Again, I've never seen it. I don't know anybody who's seen it. So it's theoretical, but you know, pretty gruesome, of course. So, you know, I already said the third bullet, so you can go on, please. Next. Okay, now let's get to the laws to try to make it impossible for women to have any control over whether they deliver a fetus or not. First of all, as you know, there is the heartbeat law now basically in Texas, which I'm sure you all know about. Whereas if you can pick up a heartbeat, even though it may be controversial that that's really a heart or that it's beating, then it's not illegal, you see, in Texas, because they're very smart, horrible people. They allow anybody to sue the woman, anybody who helps the woman, the physician or anybody who aids or abets this woman in ending the pregnancy. And you can sue for $10,000. So, you know, money talks. So this is, they felt would get them around the Supreme Court because it's not a quote law per se, but it has effectively almost completely stopped terminations in Texas. And as you now know, Oklahoma has made it illegal. So women can't cross the border to Oklahoma, where there was just one clinic anyway that was doing terminations. One of the things that Pennsylvania pulled was a woman who has a miscarriage or an abortion must have the remains buried. Now you have to understand that requires money and that requires arrangements. And usually either a miscarried fetus or an aborted fetus goes to the pathology department where it is safely and sterilely disposed of in a responsible facility, which most of them are. You know, you had Gosnell, but he never would have happened if women could afford to get abortions. They were desperate because desperate women will do desperate things. So now they want you to pay money to bury the remains of a 6-week fetus, or it's really still an embryo at that point. Waiting period. Now, Pennsylvania pulled this a long time ago, whereas you must get a signed consent in person 24 hours before the procedure is performed. This is the only procedure in medicine where that must be done. Anything else you can sign 2 minutes before the procedure, but it must be signed. And in Pennsylvania, you have to give all this information to the patient that the state provides you, which I really found hard to find sometimes in my office. So I had to apologize to patients and say, well, if you want to come back and I hope I'll be able to find it. But it shows all the various stages of fetal development, and it's basically designed to convince you not to have the procedure. Surgical facilities. For instance, there are same-day procedure units that a lot of things are done in now, hernias and You know, I had both of my shoulders done in same-day procedures. You have your colonoscopies done in places like that. And same-day procedure units are, you know, they're ventilated. They have all these rules and regulations. Well, if a clinic like a Planned Parenthood sets up a procedure room, the government in Pennsylvania decided it must meet all the criteria of a surgical facility room where they're going to operate on your joints and do all kinds of invasive procedures, which is completely and medically totally unnecessary. So what's the point of this? Oh, it's to protect women's health. No, it's not. It's to make it more and more difficult for any facility that does abortions to do them because they can't afford to update all their facilities, make the rooms bigger and store new ventilation systems, et cetera, et cetera. So again, you know, it's another barrier. And of course, the lie is they are improving the health of women. They are absolutely not. Okay, parental consent. In Pennsylvania, if you are a minor, you must have your parents sign the consent for you. Now, what's interesting is in Pennsylvania, a pregnant woman is considered an emancipated minor, i.e., a pregnant woman can sign and give consent for care for her pregnancy and delivery without parental consent. But if she's going to have an abortion and she's pregnant, she has to have parental consent. So, you know, where is the consistency in that? Now, the ultrasound before procedure is done in a very punitive way because most of the states that have laws about this, first of all, you can't have the procedure unless you have an ultrasound. Secondly, they turn the screen towards the woman. So can you imagine how conflicted most women are in this situation to begin with? You know, everybody think, oh, this is no big deal. You know, these women don't care and they're horrible and they're irresponsible and they're blah, blah, blah. They care a hell of a lot. And this is traumatic for them. It's very traumatic. Making the decision is traumatic. And then you're forcing them to see this fetus on ultrasound. And of course, the purpose is to talk them out of it and make them feel guilty and perhaps have a baby that they can't feed or can't handle or can't cope with. Of course, there are places like complete ban and criminalization, which is coming. Personhood, that's a good one. Personhood is not a medical definition. This is a legal definition made by people who do not want women to have abortions. And they want the fetus to be considered a person. So the fetus is protected under the Constitution or by law. Now, there is zero word in the Constitution about fetuses. In fact, every gender term in the Constitution is man. So we're not even in the Constitution. And I know because I took a course in constitutional law at Drexel Law School. So the fetus is not born yet. And for those of you who know the Jewish teachings, we do not consider that the fetus is a person until she or he is born, or to a Jewish mother until she or he gets his medical degree. Okay, another thing is denying Title X funds. Title X, which I will explain in a minute, helps these clinics like Planned Parenthood and other nonprofit clinics, which these all are, pay for some of the costs of abortion. Under Mr. Trump's presidency, all Title X funds were denied to any clinic, including Planned Parenthood, if they did abortions. Now, even Planned Parenthood facilities that didn't perform abortions on site were denied Title X funding. And what I think a lot of people don't realize is how important Planned Parenthood and other clinics have been to women in general. The slews of women who were uninsured, underinsured, students, and couldn't get insurance, couldn't qualify for Medicaid, all these things. They went to Planned Parenthood. That's where they get their birth control pills, which kind of, from my humble opinion, the best way to prevent abortion is to make sure every woman who wants contraception can get it and use it properly. So women don't have to be pregnant if they don't want to. I mean, you know, But therein lies religion as well, unfortunately. So I'll go over these funds in a minute. Now, Medicaid, before 1985 in Pennsylvania and since 73, because obviously administrations have changed a lot in Pennsylvania over the years, Medicaid stopped funding abortions in 1985. I was a resident then, so we had a slew of poor women coming in for abortion. Some were 14, 15. These weren't kids that could afford birth control, nor did they have access. Plus, they needed permission from their parents. So they would come in pregnant. Well, Medicaid would pay for it. Then they stopped in 85. So now poor women who could not afford to pay for an abortion basically either had to do it in a back room, have an unsafe one, or get some help somewhere. And, this is so racist and sexist and elitist and everything horrible. Oh, Eleanor asked, you couldn't find the illustration. Oh, yeah. Well, I don't know. I mean, I didn't get around it. I offered it. It's just like I couldn't find it. You know what? If I had been arrested, and it happened a long time ago, so I think the statute of limitations is over. If I'd been arrested, I would have gone to jail. I mean, you cannot tell me, a practicing board certified physician who cares about my patients, that I have to practice medicine the way you tell me to because you passed the law. This is not medicine. This is politics. This is not your purview. You stay in your lane, I stay in mine. I don't tell you how to, well, I try, to tell you how to legislate, but you have no right to pass laws that tell me what I have to say to patients. And, it's been getting worse too. And I can talk about the gag laws in a little bit as well. So the question is, you claimed you couldn't find the illustrations of the stages of pregnancy. And I'm wondering, which is true, I really couldn't. I had no idea what I did with it. And I'm wondering how else doctors performing abortions get around the regs and protect themselves from suits. It's more incarceration. It's not lawsuits. I mean, it's criminal. And I have no idea. But, most physicians, I mean, yeah, there are a few bad eggs in every field. Most physicians really are ethical and moral and care tremendously about their patients. Most of us will not do something to harm our patients no matter what. And this is why 20% of physicians have already retired in the last few years, because everything's changed. It's really a disaster. It's so horrible to be a patient. Trust me, I know I'm a patient now. You think having been a doctor would give me special license to get care, but it doesn't. So it's horrible. The government has to stay out of our exam rooms. And in fact, in Harrisburg, that's all they yell. Keep the medical society, keep the government out of our exam rooms. Well, yeah, good luck. Okay, so let me go to the next slide, please. Okay, so Title 10 of the Public Health Service Act of 1970, federal funding for women's reproductive health services through something called the Family Planning Program. And again, it provides contra services and supplies to all who want and need them. It does provide some money for services at clinics, which serve the poor and uninsured, like Planned Parenthood. It does not provide most of the funding. The funding for the care comes from donations. It comes from Medicaid in some cases, depending upon what is happening. It has come from the Affordable Care Act and the fact that with the Affordable Care Act, which has a lot wrong with it, but it's so good for women. Because now all women, regardless of copay or anything, can get free contraception, which that is just so important. Unless they work for Hobby Lobby or Holy Redeemer, but that's a whole different story. Okay. The executive, so Trump denied the payment and Biden's administration has reversed it. So Title 10 funding is now flowing to these nonprofit clinics. Now let's talk about the gag rule, which is at the bottom here. Physicians who counsel women in federally funded clinics could not refer for abortion services under the last administration. What that means is if you work for a federally funded clinic, and there are some, you could not talk to a woman who came in with an unplanned, unwanted pregnancy about the fact that one option for her was to terminate the pregnancy. Now, you don't tell doctors this. You don't tell us when we can say what is true. But interestingly, in Pennsylvania, and some of you may have read this because I think I sent it out, and also Tara Murtha of the Women's Law Project sent it out, about the CRCs, the Crisis Pregnancy Centers. These are religiously funded anti-abortion facilities that are getting our taxpayer money from the state of Pennsylvania. Their job is to try to prevent women from getting abortions and try to prevent physicians from counseling patients appropriately as to the medical truth. It is now being looked at. However, if you look at the state legislature in Pennsylvania, which I'm sure a lot of you do, and I look at daily, so I know everything that's going on, the CRCs have come up for discussion, but nothing's been done. So our taxpayer money cannot be used to fund abortions, but it can be used to fund centers that will not let physicians tell women their rights or the correct medical information. Okay, next slide, please. Okay, the lawsuits. The purpose of the restrictive laws. So the Texas law, as you know, and the Supreme Court is a whole other bag of worms right now, literally. The Texas law went through, one court upheld it, another higher court, a district court, ruled it out, then another court upheld it. And so it went to the Supreme Court. Well, the Supreme Court did not give it what's called certiorari. It means they wouldn't hear the case, but tentatively they said, well, right now the law can just go forward as stated. So they would not block, even though right now Roe v. Wade is law in terms of the Supreme Court judgment. We know what might happen, which I can talk about too, but the Supreme Court issued this. The name of this. It begins with a D. I just read an article about it today, talking about how Roberts is being ineffective to stop the justices who are doing all the damage. And they're doing this behind closed doors. There are no testimonies you can read. There's no testimony by lawyers. And they just decided by a 5-4 majority, or it might have been 4-4. So it was whatever, it might have been before they replaced Ruth Bader Ginsburg with Amy Coney Barrett, which so anyway, yeah, docket something, that's it. Yeah, okay, thank you, Eleanor. Let me read your whole thing. Thank you for clarifying. Yeah, docket something, yep. I knew it was a D, it'll come to me in 20 minutes. So anyway, right now, the Texas law has gone forward. The law in Tennessee, which limits abortions to the first 15 weeks, which, is just testing the waters to overturn Roe v. Wade. Trust me, if that wins, they'll come back with something more restrictive. And of course, there is one purpose to all of these laws that are being passed, and that is to get them to the Supreme Court, which now has an anti-choice majority. And the hope is that they will not respect precedent, which is something that Roberts does respect, and the court always respected. They will not respect previous decisions by their own Supreme Court, and they will change their mind. And the belief is that when this Mississippi bill comes up to the Supreme Court, which has gotten cert, which means they will hear it, that they will say there's nothing in the Constitution that prevents the Mississippi law from becoming law at a state. Now, one of the problems with this is that there's nothing in the Constitution about abortion per se, or fetuses, or women. And abortion wasn't even legal until sometime in the mid-1800s, and it only became illegal because the procedures that were done, they didn't have sterile technique yet. So you did an abortion, you could die from infection. Of course, you had a baby, you also could die from infection. So it was between a rock and a hard place. And so they felt they were protecting the woman from death by preventing the abortion. Of course, they weren't preventing her from dying in childbirth, but that was a whole other thing. But at any rate, they had kind of decent intentions with their limited knowledge. And, you know, with all due respect, because I know there was a gentleman present, everything has been run by, yeah, right, Barbara, you're right. Roberts no longer has the power because they'll overrule him. Very sad. But at any rate, for the gentleman here, medicine, the law, religions, everything in the world has been run by men. Women have had zero power. Now, if I had all the power, I might be able to understand why people who have it don't want to give it up, even though, of course, sharing it is, from my humble point of view, is the right thing to do. But, you know, look how hard we had to fight for the vote. Look how many years we had to fight for the vote. And still there's so many in shadow docket. That's it. Thank you, Eleanor. So these are all in the shadows. They're behind closed doors, these decisions. And that was the Texas law decision right now, because it hasn't been heard. And Amy Coney Barrett, when she was interviewed, said, you know, when she was questioned about all of these shadow docket things, well, read the testimony. Well, excuse me, lady, there is no testimony because no testimony occurred. You don't know the facts here. You don't know the medical facts. You just have a preconceived notion based on your religious beliefs and believe somehow that your religious beliefs are right and nobody else's are, and you have the right to deny religious freedom to other people. So that's where we are. Okay. All right, next slide, please. Okay, yeah. And if you guys can get into the chat, you can, I'll read this. The shadow docket is a break from ordinary procedure. Such cases receive limited briefings that are typically decided a week or less after an application is filed. And yes, the rulings are unsigned. Although after this last one, Roberts actually submitted something in writing with the women, the other women on the court, in opposition to making this decision on the shadow docket. So, you know, I mean, the guy, I mean, he's very conservative, but he has some decency. I disagree with his policies, but it's his court, it's his legacy. And he really believes in following the law. He's a very much a straight arrow, this guy. So, you know, but, you know, you're right, it doesn't matter anymore. So let's talk about lies. Okay, medication-induced abortion can be reversed. No, there are doctors. There is a doctor whom I don't know personally, and he's not an OBGYN, but he testified in front of the health committee, and I think it was either in the Senate or the House, I can't remember now. But the chair is a Republican, and he came in and he said, I reverse medication abortions all the time. Well, that's ridiculous. He's lying. For a physician to lie is inexcusable. People like that should lose their license. But guess what? Nobody's done anything to them. It's very hard to get these doctors who lie. There were some doctors lying. I mean, I'm sure you've all read about the Central Bucks school, CBW, where all the parents were screaming and yelling about mask mandates. And this physician came in and said she doesn't believe in COVID and she doesn't think people should wear masks. And of course, the people opposed to masking, you know, believed her because they wanted to. And of course, this is a woman who should lose her license because a hell of a lot of people have died in this country that didn't have to. And it's another one. Okay, so what do they say they can do? They can give high dose progesterone to women to try to reverse the effect of the mifepristone or RU486. Now, there are quite a few issues with this. And the American College of OBGYN, which is basically our body of standards and is incredibly active and terrific, has put out a statement. There is zero proof for this. We don't know if it's risky. Secondly, when the mifepristone or RU486 chemically binds to progesterone to sort of inactivate it, You can't give more progesterone and unbind it. It doesn't work. Now, the studies that were cited by the, I call them anti-abortionists because as far as I'm concerned, they're not pro-life because they don't care once this fetus is born. And I can tell you stories. But anyway, they have a few small studies that they say worked, but they're very small. They're not published in any reliable journals. And in addition, they only gave the drugs in a case where the fetus was still alive. Obviously, if the fetus is no longer alive, nothing works. So there's absolutely no evidence that this works, and it could be very risky to women because high dose progesterone can cause blood clots. It causes abnormal blood clots. It causes severe nausea and vomiting. That's why women get hyperemesis of pregnancy sometimes. They throw up all the time in the first trimester. It's because of they have a special sensitivity to their own natural progesterone. Okay, next slide. Fetus can feel pain at 20 weeks. Well, how do you know that? Have you been able to ask one? No, they have zero evidence. Is there a nervous system in the fetus? Sure. What does the fetus feel? No ideas. Do fetuses move? Of course they do. If I stick a needle in to do an amniocentesis and hit the fetus, there's a very good chance that fetus will move away from the needle. So that's why there weren't too many fetuses injured when we used to do amniocentesis blindly without ultrasound. So the fetus has reflexes. Does that mean the fetus feels pain? No. Can you prove that the fetus does or does not feel pain? No. It would be very terrible if the fetus does, but there's zero proof. Okay. The other thing is life begins at conception. Now, that is a religious definition. That is not a medical definition. What is life? So let me tell you the reality. A sperm is alive, an egg is alive. They are living cells. They have the potential to combine with another cell and form a fetus. So is the sperm alive? Is killing a sperm killing life? Every cell in our bodies is alive. And in every other species that is animal or plant. So how do you argue about this? This is ridiculous. They're using words to try to define an issue that they cannot define because nobody can. And of course, the biggest lie, which people throw at me all the time when I try to talk about this from a medical point of view, which is how I try to keep it. And even with certain physicians who are, quote, pro-life, they will argue, well, you pro-abortion folks. And I try to explain to them, number one, I'm not pro-abortion. I don't like abortion. I would like women only to have pregnancies they want. I would like babies to be born in a situation where they're not going to be abused, where they're not going to be drug addicted, where they're not going to be taken away and put in foster care, where they're not going to have enough to eat, where they're not going to have a serious disability that cannot be taken care of by the government, where, there's so many reasons, but it's not my choice. It's not my choice for my patients. I have never personally had to make that choice. I am very grateful that I never had to make that choice because I don't know what I would do. But it's not the Pope's decision what choice I make. It is not Kathy Rapp, Pennsylvania state senator, choice what I do if I have an abnormal pregnancy. And I will be honest, when I was a resident, and I didn't go to medical school till I was 32, and I had the one child, and I kind of accepted at this point, he's turning 5. He can go to kindergarten. I cannot be a bad mother now by going to medical school. And I thought I was pregnant in my 4th year of medical school. And it was stress, thank God. But I thought to myself, oh, damn, I'm going to be 36 years old. I still have a 4-year residency to do. I have $50,000 worth of loans. How am I going to take maternity leave, which they didn't give us? stay home with a baby? How was I going to breastfeed a baby? I was really panicking. And I even had one of the guys in my class draw a beta HCG on me, which thank God was negative. But I mean, I kind of know what women feel. And this was a matter of, it was going to mess up my career, which I waited a very, very long time to get started. But I don't know what I would have done. Maybe I would have sacrificed my career, but that's not other people's choice. That's my choice. So I'm not pro-abortion. I'm pro women have brains. We can make our decisions, and there are physicians can explain these things to women. And trust me, women know what they want. They're not as conflicted as they're made out to be. Okay, so pregnancies caused by rape. Oh, sure. Well, yeah. There's one, the Oklahoma law, and I think it is, and someone can correct me, because that one was just passed. There may be an exception for the life of the woman, but not for rape or incest. And I'm just about done, Rhonda. So I don't know how long I've been talking. I'm just doing my thing here. But yeah, I did a C-section on a 10-year-old who was a clinic patient. When I was at Einstein for 4 years as an attending. That was my first job out of residency. And so I had a private practice, but I also was responsible for a very large percentage of the residents, the clinic patients. So this kid, don't tell me this kid was irresponsible in not using birth control. What 10-year-old could consent to having sex? But it was a poor family. They probably didn't know she was pregnant. Who knows what the situation was? Obviously, if she could have an abortion, it would have been better. And her pelvis wasn't even developed enough to deliver vaginally. So we have a 10-year-old kid who had major surgery to deliver a baby. You think about that stuff. I have never forgotten that. Next slide, please. Okay, so Roe v. Wade, this is the history. I'll let you read it. I'm sure you all know about it. So it went to the Supreme Court. In New York, in 1973, by the way, abortion was already legal. So I do know kids I went to high school with, if their families had money, they would go to New York. And the rest of them, one girl in my high school used to hang her in the girls' room. And I saw them taking her out on a stretcher, and I never went in the girls' room again the entire time in high school. So it's pretty bad. Next slide, please. Okay, so they appealed the case to the Supreme Court. And the majority actually, and it was Brennan, right? Remind me. Said it, the Ninth Amendment right to privacy. And they used that and said that a woman should have privacy when she's pregnant because that fetus is inside of her. And they extended it up to the time of viability. Next, please. So state laws. In Pennsylvania, legal limit now is up to 24 weeks. And right now, this is what Pennsylvania is trying to do. They are trying to introduce an amendment to the Pennsylvania Constitution that our Constitution in Pennsylvania does not in any way state there is a right to an abortion, and that taxpayer dollars are not allowed to be used to fund abortion. Now, what this does is the attempt is to change the Pennsylvania Constitution so that when Roe v. Wade is overturned, which they expect to happen, Pennsylvania already has said you don't have a right to an abortion, and they can make it illegal at any time they want. The way this works, if you read the last bullet, you have to have 2 consecutive terms of approval by the House and Senate, and then it goes on the ballot. This bypasses the governor. And for those of you who know anything about amendments, most constitutional amendments pass. People don't know what they're doing. They just vote yes. So this is really, really terrible. Next slide, please. Right now, docs are having trouble learning how to do abortions. The residents are not learning safe procedures. And an example of, now, of course, the religious hospitals that have residencies, that are against abortion. The residents they can't even do tubal ligations in those hospitals or prescribe contraception. This is wonderful. But in addition, for instance, Hershey Hospital, which is funded by Milton Hershey, in the charter says abortions cannot be performed at this hospital. It's not a religious hospital, but the residents don't learn abortions, and those who want to learn have to find a way to do a rotation at an outlying clinic. So you're limiting the number of people that have the skills to perform a safe abortion. This is bad. Okay, next, please. Okay, so what are the consequences? Poisons, hangers. You know, this is not drama. This is true. Women used to put Lysol in their uteruses to try to get rid of pregnancies. I'm sure you understand that it didn't just kill the pregnancy. It often killed the woman. Holes in the uterus. They used to have things in hospitals called septic tanks, where all the women that had become infected from illegal abortions were hospitalized. Many of them had their uterus removed. Many of them died. Many women died from self-induced abortions. We know that abortion became legal in Ireland because a woman who just happened to be a doctor died because they wouldn't empty her uterus when she was septic from breaking her bag of waters prematurely, because the doctors were afraid they'd be arrested. So a woman died, you know. So next, please.
That was pretty recently when they made it.
Yeah, it just happened. You know, these Catholic countries are making abortion legal or getting rid of them being illegal. And here we have the US. This is a cartoon, which was done, it came out in the LA Times in 1988. And it's by a man named Paul Conrad. The black circle is, I don't know what the hell happened. But his name was Paul Conrad, and it is titled Alternative to Roe v. Wade. Next, please. So we're fighting, and we will do the best we can to save women's lives. From my point of view, this is not about people's personal beliefs. It's to save women's lives and to practice responsible medical care. And I object to anyone who does not know what they're talking about trying to limit that medical care. So any other questions? Okay, thanks very much.
Thank you so much, Sherry. That was
Oh, my
very,
pleasure.
very. Can you hear me?
Yeah, I hope that it was, I tried to make it straightforward, and
It was very clear and really very factual and a great
Great.
deal of very important information. And thank you so much. I think it was a terrific presentation.
okay, and I'm sorry I took so long, but you know.
No, absolutely. It was so informative, and, we just appreciate, and, the only thing I think we're all feeling right now is angry, not at
Oh,
you,
sorry.
but at the
Oh,
situation.
no, I know.
And
Absolutely.
frustrated.
Oh, yeah.
But
And we have to use that anger in a constructive way.
absolutely. Thank
So
you all.
if you want to show this, since it's recorded, it's fine with me.
Okay, thank you. This will be, once we download or upload all this, it'll be sent over to our technical person, and it'll be up on our website. So if you know anyone who wants to view it, who hasn't had a chance to, or anyone would like to review it and go over some of it, please go onto our website. Thank you again, Sherry, and
Yes.
everyone for coming tonight.
Yes,
Thank
thank you,
you.
Sherry, for all the
you
information.
all.
Really appreciated
Great
it.
to see you all.
Really
Thank
appreciate
you.
it.
Okay,
This
bye.
really highlights the importance of voting.
Oh,
Yeah.
yeah. Oh, yeah.
Sure.
Absolutely. Absolutely.
Thank you.
Bye.
Thank
Bye,
you,
thank you.
and happy Passover to everyone.
Yes, same to you.
Bye-bye now.
Bye.